I'm Anaga Kamet.
And this is a schizophrenia and schizophrenia spectrum and other related disorders.
Oh.
Okay, we got it. So schizophrenia is classified by 5 disruptive behaviors to one's life, categorized by delusions, hallucinations, disorganized thinking, grossly disorganized and abnormal motor behavior, and negative symptoms. Delusions include bizarre ideologies, and they cannot be changed by outside guidance or any outside kinds of influence. Hallucinations are perceptions from the brain that are not stimulated by an outside stimulus and are usually occur when awake. Disorganized thinking includes loose associations between topics and then random answers to questions, incomprehensible speech. Grossly disorganized and abnormal motor behavior can range from childlike behavior to things like unreactivity or excessive motive activity. And then negative symptoms include diminished emotional expression and difficulty expressing certain things, like algia is diminished speech output, and anhedonia is difficulty expressing pleasure, and asociality is the lack of interest in social activity. The criteria includes delusions lasting longer than a month. Aside from impacts on certain conditions, behavior is not out of the ordinary. Manic and depressive episodes are very brief. Disturbance is not caused by medication and cannot be explained by other disorders. And then things to take into account is it must exclude coexisting conditions. Brief psychotic disorders, it must last more than a day. It remits by 1 month. Schizophrenia form disorder is present for around 6 months. Schizophrenia just by itself lasts for 6 months. And schizoaffective disorder is the same as schizophrenia plus 2 weeks of delusions and hallucinations. The brain chemistry is affected by 4 things: dopamine, glutamate, ventricles, and the amount of brain tissue. So the dopamine has to do with pleasure and reward, and it's going to be the hyperactivity of dopamine D2 receptor, and that is what affects the delusions and hallucinations. Glutamate it affects the negative symptoms of schizophrenia, and it's hypofunctioning in the NMDARS, resulting in depressed GABA inhibition. The ventricles tend to undergo enlargement, and that is caused by thalamic shrinkage. And then for the brain tissue, they experience a loss of brain tissue after their first severe psychotic episode.
For the treatment of schizophrenia, there are 2 main options. One is non-pharmaceutical and one is pharmaceutical. The non-pharmaceutical must be used in conjunction with pharmaceutical in order for it to be effective. For non-pharmaceutical treatment, this focuses mainly on individual, group, or cognitive behavior therapy, which changes the individual's form of thinking and can help detect an onset of a psychotic episode and reduce them in the future. CET, or cognitive enhancement therapy, is also an option, along with metacognitive training, narrative therapies, and mindfulness therapy, which all target the individual's form of thought. Graphics can be seen here. For the U.S. population, a relatively small amount of people are diagnosed with schizophrenia, which is around 0.6% to around 1.9%, which is 5.1 out of 1,000 lives. From a worldwide perspective, schizophrenia diagnoses are prevalent in Southeast Asia and other countries such as Africa, as can be seen by the table, which has a brighter red color for areas with more diagnoses. Between gender, it was initially thought that men and women had equal amounts of diagnoses, except recent studies have shown that higher percentages of men are affected with a ratio of around 1 to 0.42. For men, the schizophrenia symptoms usually are shown from ages 18 to 25, whereas for women, these symptoms are shown later from ages 25 to 35. Genetics play a huge role in the onset of schizophrenia, as can be seen by the table here, where it is shown that for the general population, or people who are not related to people with schizophrenia, there is a very low chance of having the disorder, which is around 1%, whereas for identical twins, there is a much higher risk of around 48%.
The overview, so the 5 categories that are in the disorder are delusions, hallucinations, disorganized thinking, disorganized motor behavior, negative symptoms, and then for the diagnosis criteria, it's delusions lasting 1 month. Disturbances are not caused by medication. Behavior is normal outside of the symptoms. And for the neurotransmitters affected is dopamine, glutamine, and there's also ventricle enlargement and loss of brain tissue that are affected in the brain.
For treatment and frequency, treatment options range from pharmaceutical to non-pharmaceutical, which must be used together. Treatment options for pharmaceutical include antipsychotics, whereas for non-pharmaceutical treatment is therapy, behavior therapy for individuals or group. The frequency of schizophrenia is that it affects 0.6% to 1.9% of the U.S. population, with differences caused by cultures and their environments worldwide, gender, and genetics.
Thank you. That is our completed presentation.
Thank you so much for listening.